Hello, my name is Stephanie Van Marter, and seated with me is Dr. Nicole Rodin. We're here to talk to you about opioids and substance abuse here in our community, and specifically to talk to you about a new threat that's facing all of our communities, and that is illicit fentanyl. I'm Assistant U.S. Attorney here in the Eastern District of Washington. I have been with our office for 18 years, and I've been in the law enforcement community for over 25 years. My most recent assignment at the U.S. Attorney's Office is to target drug trafficking organizations who are importing mass quantities of controlled substances into our community, and more specifically, illicit fentanyl.
My name is Nicole Rodin, and I am a clinical assistant professor at Washington State University, College of Pharmacy and Pharmaceutical Sciences. I am trained as a pharmacist, and I have been working educating about misuse and abuse of prescription opioids since about 2013. Currently within my role, I do a lot of presentations with students, kind of talking about the topic of misuse and abuse of medications and how to use reversal agents like naloxone. So I want to start out today by talking about what we're kind of seeing within the realm of teens and how we see their opioid usage. You see a few stats on your screen here, and I just want to point out that these are not large numbers, and that's fantastic. So we only see about 3.6% of adolescents reporting illicit use, which is great. And we do see these numbers trending in a more positive direction, but we do have data that this is an issue, and unfortunately we do project it to continue to be an issue. Specifically here within the state of Washington, we do have really good survey data every year with the Healthy Youth Survey. And again, we're seeing really positive numbers. We're seeing upwards of 95% of students reporting that they are not using illicit substances or misusing or abusing prescription medications. This is fantastic. Our goal here today is to close that gap, that 5%, 2% gap, so that 100% of our students are not misusing or abusing prescription drugs. And before we start, I do just want to give a little bit of definitions to give some context to what we're talking about. I know we're all very familiar with the term opioid, and this is going to refer to any substance, whether it is prescription or illicit, where it elicits this response in our brain from the opioid receptors. Traditionally, fentanyl is going to be a prescription medication. It absolutely has a place in therapy, but that's not really what we're talking about today. When we talk about fentanyl today, we're going to be talking about illicit fentanyl. So this is going to be a synthetic opioid that is made in a lab and that is not made within a drug manufacturing facility. It is not overseen by any regulatory agency, and it does become more dangerous because there is no oversight. So we did just want to make that distinction before we kind of dive into this. So for these medications, like I mentioned, the opioids, whether they are illicit or prescription, are going to work within our bodies the same way a key works within a lock. So all of these different substances are going to have very similar chemical structures. So when we see these bind to the receptors, we see them kind of produce very similar effects, but the more synthetic that the opioid is, typically the stronger it's going to hold on to that receptor. And this becomes an issue because when we start to see reversal agents like naloxone not work on those compounds. So the synthetic fentanyl is going to be holding so tightly to that receptor that naloxone can't kick it off. So we're not able to reverse any of those negative effects within the body. So specifically, if a patient is not breathing, unfortunately, we are not able to bring them back to spontaneous breathing because that synthetic fentanyl is so potent and holding on so tightly to that receptor. So this is certainly a bigger issue than we have seen in the past, and certainly more dangerous than any other compound we have seen in the past either.
So why is it that we are so focused on spreading this message to you today about the dangers of illicit fentanyl as it applies to what we have all talked about, the opioid epidemic? In my 25 plus years in law enforcement and in talking with other officers and agents, the illicit fentanyl is the most dangerous drug that we have seen introduced into our communities. And unfortunately, showing on the screen in front of you are representations of overdose victims, overdose deaths that have occurred here in the Eastern District of Washington tied directly to fake pharmaceuticals and illicit fentanyl. So how is the influx of illicit fentanyl affecting us here in this community? On the screen in front of you are different representations of seizures of illicit fentanyl made to look like pharmaceutical pills that have occurred here in the Eastern District of Washington. When we first saw fentanyl, it was back in 2016, and there is a picture, a circular picture, that has a stamp of a dancing devil. In that operation, we thought we were purchasing 10 kilograms of heroin from a drug trafficking organization out of Mexico. Unfortunately, it ended up being 10 kilograms of fentanyl, a substance that law enforcement was not very familiar with, nor did they have any idea how dangerous fentanyl was. Fentanyl, especially in powder form, can be breathed in, it can be soaked through the skin, and because it can be fatal in such small quantities, it poses a risk to anybody who handles it. And unfortunately, across the country, law enforcement has had to learn the hard way as to the risks that are posed by illicit fentanyl, whether it be in pill or powder form. When we first saw fentanyl introduced in 2016, it was a shot across the bow to law enforcement that these organizations were now focused on a new type of drug to introduce into the market. Law enforcement and the community, our community partners, had been so focused on raising awareness as to prescription medications and their abuse that they began doing a really good job of curbing it. As Nicole said, we were doing a good job of educating our youth. Well, when that happens, illegal organizations will pivot. They will find a new controlled substance that they can make money off of. And unfortunately, that was fentanyl. And where we have seen it introduced in our communities has been in the form of fake pharmaceutical pills, pills that are made to look safe, pills that are made to look like Oxycontin. And when they were first introduced as little blues or Mexi blues, a lot of our end users had no idea what they were purchasing. They did not realize how dangerous these fake blues were. And unfortunately, that is a direct correlation to the increase of overdose deaths that we've seen here in this district and across the country. Since 2016 and 17, the flood of these fake pharmaceutical pills has increased. On your screen are seizures, as I said, from this district, upwards of 55,000 illicit fentanyl pills at a time. I can't even begin to guess how many fatal doses are represented in those seizures alone. And now they are made to look like fake Oxycontin, fake Xanax, fake Percocet, and even baby aspirin. So why are we so concerned about illicit fentanyl? As Nicole was talking to you earlier, this particular drug is incredibly powerful. And it is also fatal in very, very small doses. If you were to take a sugar packet and dump it onto the contents of it onto a table, and you were to separate 3 to 5 granules of the sugar, that would be sufficient to cause a fatal overdose with fentanyl. Unfortunately, they are using different forms of fentanyl, like carfentanil and other analogs, now that they have gotten used to making these fake pharmaceuticals, and they being these illegal organizations that are making money from the sale of these pills. On the screen, you'll see pictures of vials. One picture represents a quantity of heroin, another picture represents a quantity of fentanyl, and the third represents a quantity of carfentanil. Those are visual representations of the amount necessary to cause a fatal overdose. Unfortunately, with the production of these fake pharmaceuticals, the organizations are obtaining fentanyl illegally from China. They are making in large labs these pills by literally dumping powder fentanyl into a pill press and pumping out thousands upon thousands of pills. As Nicole said, there is no quality control. There's no way to know how much fentanyl is in one pill versus the other. And unfortunately, we've had cases where friends have purchased 7 pills and shared 2, causing a fatal overdose in one friend while the other was able to survive. There's simply no quality controls, and they are incredibly powerful and very potent. On your screen are pictures of the representation of a lawfully prescribed oxycodone and an illicitly manufactured fake oxycodone with fentanyl. They look virtually identical. And we're seeing the same thing with other fake pharmaceuticals, like I said, with Xanax and Percocet. We tried to get an idea of what the increase of illicit fentanyl was across the country and in our community. We began to work with the DEA lab to get an idea of what types of and quantities of submittals were being presented to them. And again, this represents what law enforcement was able to seize not what has actually hit the streets of our communities. Here, predominantly, we are seeing it in that pill form. And of the seizures in 2018, 180 kilograms of the fentanyl that was sent to the DEA lab represented the fatal dose amounts present. So again, it's a representation of simply how scary the influx of illicit fentanyl it is. So what's the correlation, unfortunately, to our opioid epidemic and our overdose death rates? I think the correlation is direct. The presence of illicit fentanyl has had a direct impact on the increase of overdose deaths in our communities and across the country. We have worked with several different groups to try and identify what the scope of that problem is, and we are seeing a percentage increase in the detection of fentanyl by the medical examiner's offices and representative in overdose deaths. And on the graph on the right, and we'll talk about this in a bit, illicit fentanyl users and the risks. It does not discriminate. It does not pick a particular age group. It does not pick a particular type of individuals. It is affecting all age groups and individuals from all backgrounds, including our youth. We've also been working with a high-intensity drug trafficking units here and across the country to try and get an idea of the impact of illicit fentanyl on overdoses. As Nicole also said, with fentanyl, because it is so powerful, naloxone does not always work, unfortunately, and it does not always save individuals' lives. So some of the OD mapping programs that we have been utilizing not only give us a geographic area of where some of these overdoses might be occurring, but if naloxone was administered multiple times without success, it gives us an idea that illicit fentanyl is likely present. And we are doing that in the Tri-Cities area with the cooperation of Benton and Franklin County law enforcement, as well as here in Spokane. And unfortunately, all of us have been dealing with the impacts of the COVID-19 epidemic. Those in our communities who are drug users, those in our communities, unfortunately, who are experimenting, who face all kinds of challenges like depression and the like. We unfortunately are now also seeing an increase in overdoses during the time period of the epidemic, upwards of over 40%. A large majority of those overdoses, again, are being tied to the introduction of illicit fentanyl into our communities and here in the Eastern District of Washington. It is being hidden in fake pharmaceuticals. It is also being co-located with heroin, marijuana, and other controlled substances. Unfortunately, in the California area, they actually had their first fatal overdose with the use of a vape pen as well.
What makes these so addictive? Well, just like anything else in our brain, whenever there is a release of dopamine, our brain is going to tell us to continue to do this. Every time we take one of these substances, whether it is legal or illegal, it gets into our cells and it starts this chain of reactions, which ultimately ends in the dump of dopamine. The tighter it holds to those cells, like illicit fentanyl, the more that dopamine is going to be released into our body, and our brains really like that. This is a signal that says, keep doing this is favorable, this is gonna help us survive. So while it starts as a really rush of feel good, it quickly transitions to a need. So as this dopamine starts to flood our brain, and it does so on a much more consistent basis, it does start to change the wiring within your brain. So with this wiring changed, we again see it transition from a want to a need, where if we don't have this chemical within our system, we start to experience very severe withdrawal. So it is that dopamine that's making these substances so addictive. And with anything that is changing the brain structure or chemistry, we know that it is going to have a bigger impact on those adolescent and molding brains. So with our brains, we are continuing to develop through our mid-20s. So the actual parts of our brain that are still developing tend to be the amygdala and our frontal cortex. And these parts of our brains really play a big role within our decision-making processes. So this does not mean that as you are younger or an adolescent or a teen that you cannot make good decisions, but it does mean that the way that you make those decisions is a little differently than somebody who is older or has a fully formed and finished brain. So one way this is different is the way that we weigh risk versus benefit is going to be weighed differently. So as your brain is still forming, you are going to see the benefit much, much higher than you would see the risk. And this is a problem. As we heard Stephanie mention, these pharmaceuticals or these fake pharmaceuticals look identical to real pharmaceuticals, so they're shrouded in this veil of confidence where they think they are doing something that they're familiar with or that they have the resources to identify the risk, when there is no way for us to identify these risks of the illicit fentanyl or the content within these tablets. So not only is our risk versus benefit a little skewed within our brain, but our actual assessment of what is even a risk tends to be a lot more hesitant. So we don't see bad decisions inherently made, but we do see an opportunity for a lot more transparency and a lot more education. We need to identify what those risks are and what those benefits are and clearly communicate that to our staff, to our students, to the parents, to essentially everyone involved, so that we're able to see and able to make those decisions long-term on a logical basis. So that's part of the reason why we're here and kind of spreading this message.
So who's at risk? As Nicole and I have said, everybody. With illicit fentanyl and these fake pharmaceuticals, it is literally like playing Russian roulette. And it is so important, as Nicole said, to spread a message of awareness and education that these illicit fentanyl pills exist, so that our youth and our communities are aware of it and can weigh those risks, that risk benefit, like Nicole said.
And there are certain signs of drug misuse or abuse. Some of them can be unusual fatigue. This is a very common side effect of any opioid, especially that groggy, drawn out feeling. Especially something like mood swings or constipation are also very typical with opioids. And then any sign of withdrawal. So withdrawal can typically be seen in excessive sweating, tremors, shaking, very severe mood swings, high heart rate. It is not pleasant. But it is to be noted that you cannot die from opioid withdrawal. It may feel like you are dying, but as a caregiver or a parent, it is important to note that someone going through withdrawal cannot die from the withdrawal itself. And this is not an all-inclusive list of signs of misuse or abuse, but it can give an idea of when to start that conversation. Truthfully, the biggest way to see a sign of drug abuse is going to have that relationship and to be able to bring up that conversation in much less of a taboo way. We certainly want to destigmatize this, so we encourage having that conversation.
So what can we do? As Nicole says, build relationships, communicate, and talk to each other about these potential risks.
Yeah, and we definitely want to keep naloxone on hand as well. So Washington State has done a phenomenal job of increasing legislation to make naloxone more available, and it is beneficial to have it on site. Being familiar with Good Samaritan laws. So this is something I like to communicate to my students, and I think it is very important that within the state of Washington, we do have Good Samaritan laws, and it is always the priority to call for help when help is needed. Sometimes there is that hesitation when there is drug paraphernalia around, but being aware of the Good Samaritan laws that are in place can help ease those fears so that someone is able to get the medical attention that they do need. We want to talk to parents. Even if this is a very uncomfortable conversation, we want to let them know that we are educating students on this, but we want them to be educated too. And then being very familiar with school-specific resources. Spokane and Eastern Washington is very resource-rich in general. The tricky part is identifying it and identifying what is available to you. So kind of having that knowledge beforehand helps those conversations just a little bit easier. And then one important one is going to be taking caution when you are confiscating anything, especially if it could be an illicit substance. Like we heard earlier, fentanyl is really good at absorbing through the skin. So if it is in liquid or powder form, there is a high chance that it can absorb through the skin, or if it gets into the air, there's a high chance it can be breathed in as well, which could cause a fatal overdose in somebody who is handling those substances. So just being aware of that, especially with our policies and procedures for taking medications or substances from students.
So what resources are accessible to you? Here in the Eastern District of Washington through the U.S. Attorney's Office and our partnership with the school districts, with law enforcement, with groups like Nicole has been a part of in combating the opioid epidemic, all people are trying to work together to spread a message and to provide resources to you in the community. On the screen are several links that you can access additional information. And as illicit fentanyl and the campaign to raise awareness about its presence is growing, there's more and more messaging available for free for you, for your schools, for your parent groups. And I always like Nicole's message, and that is sharing is not caring in this particular instance. These illicit fentanyl, fake pharmaceuticals, are so very, very dangerous. One pill can cause a fatal overdose. That's the negative side. But the good side and the positive message is that we together can spread the word about this threat, and we can spread prevention and education. And so we encourage you to access the websites that are shown there. And please reach out to us if you know about more information that we might be able to use. And we are also available as a resource for you. If you have any questions, please feel free to contact myself or Nicole. We are available to answer questions and to continue to spread this message of awareness to all of you.
Awesome. Thank you.